This is Gary Atensi with CNTV, and today we're in Inglewood, Colorado. We're at Mile High Insurance. I'm here with three of the partners here that basically have brought together a great service for folks out there. I'm here with Jack, Wade, and Robert. Let me ask you, first of all, Wade, when you open the doors here, you're definitely not new to the rodeo here. You guys have been doing it for 20 plus years easily. A lot of experience under one roof. What were you hoping to provide different when you open it up here?
Try to sit down and look at every company or every individual on an individual basis to make sure that the programs they try to find and look at are going to be the type of program they can afford, number one, and still have the kind of coverage that they need for them and their families.
Jack, give me an overview of everything you can offer now for folks out there.
Under Mile High Insurance, we can offer anything from individual insurance, group health insurance products for companies from 1 to 250, even higher than that. We can also offer life insurance, disability insurance, and any other group product that would be able to implement into any type of company.
Robert, we're talking about a lot of providers out there of insurance. How do you guys make it an easy, user-friendly environment to wade through all these options for the consumer out there?
I do the research myself and find what I feel is the best product out there, and then I recommend it to my clients. That can be a Medicare supplement product, a Medicare Advantage product, or anything along those lines.
Wade, this isn't a one-size-fits-all type of insurance anymore. We're talking about customized plans people need out there because they have different issues, different health requirements. Tell me about that.
Well, we try to take a look at if you're under the 10 employees for group insurance, there's very low deductible programs which are becoming extinct really because of affordability, to high deductible health savings account programs, high copays, sometimes even having just high deductible plans, and then put gap plans with them to try to cover some of those high deductibles, but they're all dictated by the dollar bill.
Wonderful. And by being creative, obviously you experts here can put together a plan. It's kind of the happy medium.
Yeah, and even some carriers have multiple plans that they can offer to their group. So one plan might be good for one employee that hardly ever goes to the doctor, having a generic drug card program, where another program that an employee has to have brand name drugs. That way they can offer that to their employees and still have multiple plans for each employee to choose from, which makes it even a better program for the whole group as a whole.
If there's an employer out there who's thinking about bringing on group insurance, what do they need to look at? What should they watch out for?
You want to watch out for people that bring in high deductibles, don't explain the programs to the employees, and the employees get burned in the long end. They don't know how the plan works, and when they actually have to use it, they get very upset when they have a huge out-of-pocket. They tell the employer the plan is awful, they don't like it. It causes morale issues inside the company, and you lose good people.
Let's start out first of all with individuals. What do you recommend for a brand new couple out there just starting out on their own based on their budget?
Well, in today's time, especially if they haven't had any children and planning on children, the individual plans now, as of January 1 of this year, covers maternity, which is a big deal. Obviously, the cost has gone up a little bit. You know, looking at that, we have the preventive care package that covers everything from mammograms, pap smears, to prostate screening, all that kind of stuff. Our preventive care package is extremely good for everybody, no matter what, if it's an individual or a group plan. Then we go in and try to say, okay, are we saving for a house? Do you have a house? I mean, we actually even do financial planning on the health side of it and making sure that if somebody did get real sick, can we afford to have those big deductibles, and then take a look at it. Is a health savings account a program should be looking at? Or is it a copays is better, or on a certain prescription? How much cost is that going to be on a monthly basis? There's several things that we should be looking at to make sure it's just not the premiums, it's not just the deductibles. Is if you've got to go to that doctor 3-4 times a year, that adds in copays and all of those type of items that add up quickly.
So we're talking about an individual or a young couple out there. Still preventative is the way to go. Let's talk about the other side of the spectrum here. We're talking about senior citizens who really can get pretty frustrated about wading through a lot of these options out here. Tell me what you have for them.
First of all, 10,000 people a day are turning 65 in the United States, so that's a growing market. Medicare can be a complicated issue. That's all there is to it. You can look at Medicare supplement plans and a standalone prescription drug plan, or they have what's called Medicare Advantage plans now. And those are available in certain counties across Colorado. That's why it's nice to have an agent that's experienced, that knows how to compare plans and offer the best plan to them. Every year, there's what's called the annual enrollment period, and that's October 15th through December 7th. And during that period, People who have Medicare supplement plans can switch prescription drug plans, the only time that they can do it during the year. Now, people who have Medicare Advantage plans can also switch Medicare Advantage plans during that time period. And if you have a Medicare supplement plan, you want to try a Medicare Advantage plan, that's the only time of year when you can sign up. Now, the other thing that I wanted to mention is some people continue to work beyond 65. It's becoming a more popular trend these days. Now, those people can stay on their group plan, of course, or they can enter what's called a special enrollment period. And anytime after age 65, they can sign up for Medicare and get a supplemental plan and a prescription drug plan, can save their company or themselves a significant amount of money. And so they can save money and get better coverage if they consider going on Medicare, even if they continue to work.
Excellent. Yeah, we're not talking about a small niche anymore. You're saying a lot of people out there, a lot of seniors out there needing help. What about a specialty group like self-employed?
We can do business groups of one in the state of Colorado. We can do it. It's a difficult insurance to get sometimes because there's a lot of additional hoops to get through. Or you can get individual coverage if you're a healthy person. If you're not healthy, we can certainly direct you to Cover Colorado, which is the uninsurable pool. Or we do have a plan that's limited medical, and it'll cover certain things. So if you do have an accident, you might get $1,000. We may pay you $1,000 a day in your hospital. There's always a way to find coverage. I mean, we can always find it for you. It's just a matter of what the cost is, what you're looking for from a benefits perspective. And we're also going to give you guidance. Just to walk around with a card in your pocket that says, I have a $25 copay, may not be, as Wade has said in the past, the best financial spot for you to be in. So it's each individual gets worked on differently.
I mean, it's nice because with technology, they make it easy where you can actually log on right there, get this quote, but obviously that's not where it ends. This is a community-driven business. That's just the beginning. So once you guys get that information, are you able to put that customized plan together for them?
Yeah, and that's the secret, is really to sit down and interview these people. And then what they think is not that big a deal or a health issue might be a health issue to the insurance companies. And I really think that the insurance companies have done an extremely good job. I mean, they're the first ones to get criticized, but if you take a look at all of the different programs that have been put together by the legislation of the state, we've got good programs. As time goes on, if Obamacare comes into play, that might change too. And so they need to know those rules and regulations once that happens too. But I think that put together programs that really make a lot of sense, and they're educated on what they should and shouldn't do, and that's what our job is.
And speaking of a lot of changes out there in the insurance world, how important is it to actually go out and get a competitive analysis done?
I think every year you get an annual renewable time frame. If it's a group, you have renewables at the first of the month once a year, and that's usually when people take a look and see, does the other insurance carriers out there have a better program? It still comes down to the bottom dollar. Being creative and look at those plans. Sometimes a high deductible plan makes more sense to them than a low deductible plan.
Once you get them in place here, they're going to basically be here to walk you through each step of the insurance process, even with a financial side of it. Somebody out there who is underinsured, they know they're underinsured, what would you tell them? What's the first step?
If they're uninsured, take a look at what the condition is. Let's call an underwriter ahead of time, see what that condition means, and then there is the state Cover Colorado program that's available to everybody. That's a great program. There's many programs that you'd be surprised you can qualify for, yet maybe not, and then you have that alternative idea going to the Cover Colorado.
Wonderful. And one of the things you said, Jack, is basically anybody is insurable. You just got to put together a plan that works for them. What would you tell folks out there who have not been able to get that done for them?
Give us a call. Let us know how we can help. I mean, everyone says I'm between a rock and a hard place. I may not have the best answer for you, but I'll get you an answer. If I say you do have to go to the uninsurable pool, we'll send you there. But there's also creative ideas out there that people just haven't been exposed to. Insurance is a scary thing. People don't like to deal with it, nor do they like to pay for it, but it's a necessary evil. And we can direct them down the particular road they need to go. And a lot of people who come in here are really surprised, going, well, that really wasn't that bad of a process. But we also make sure we watch their budget. We don't want to make anybody insurance poor or overload them. There needs to be a little happy medium in there. And we want to make sure you're happy. We want to have you for 20 to 30 years.
Folks, just keep in mind, like I said, the website is out there as well. But we've also put the phone number at the bottom of the screen because I imagine there's a lot of seniors out there that really aren't surfing around on the web and they're looking for a human on the other side of that phone. What would you let those seniors know?
There's a lot of different issues that seniors face when they need to protect themselves.
Absolutely. Once again, folks, that is Mile High Insurance. Their contact information is on the screen right there. What you have down here, folks, is a collaboration of professional experts that have been doing this for many, many years. They can walk you through the step, make sure out of the wide gamut of everything that they can offer you, you're going to get something you're happy with, fits your budget, and most importantly, is there when you need it. This is Gary Atencio with CNTV, and if you don't know, now you know.